Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Meloxicam. Its brand name is Mobic. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Meloxicam is classified as an NSAID, or non-steroidal anti-inflammatory drug. It has anti-inflammatory, analgesic, as well as antipyretic effects. Its effects are related to its ability to inhibit COX-1 and COX-2, which are cyclooxygenase enzymes. This would lead to a decrease in prostaglandins in peripheral tissue. In terms of indications for use, this medication is indicated to be used in the treatment of osteoarthritis, as well as rheumatoid arthritis. And it can also be used to treat polyarticular juvenile rheumatoid arthritis. Now, before somebody was to use Meloxicam, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. So if an individual had an asthma-type reaction or an allergic-type reaction following the administration of aspirin or any other NSAID, they would not be able to use Meloxicam. Patients with a hypersensitivity to Meloxicam or any other component of the product would not be able to use this medication. And finally, for contraindications, this medication, Meloxicam, cannot be used for postoperative pain following a coronary artery bypass graft surgery. Now, in terms of precautions, this medication is on the Beers criteria, which is the list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving Meloxicam to the elderly population unless other pain medications are not effective and they're able to take a gastroprotective agent, something like pantoprazole that we discussed in the past, due to the increased risk of gastrointestinal bleeds or ulcers. Cardiovascular thrombotic events, such as myocardial infarctions or heart attacks, as well as strokes, have been reported in patients using this medication. However, the risk may be increased during prolonged use or higher doses being given. There's a risk of new or worsening of pre-existing hypertension or high blood pressure with the use of this medication, so monitoring of blood pressure is recommended. Patients should be made aware that fluid retention or edema may occur with the use of Meloxicam. Patients with heart failure who use Meloxicam may be putting themselves at an increased risk of experiencing a myocardial infarction or a heart attack. So we would want to avoid giving this medication to patients who have severe heart failure unless the benefits outweigh the risks. We want to avoid using other NSAIDs or non-steroidal anti-inflammatory drugs with Meloxicam as they fall under the same class. Some patients have had skin reactions while using Meloxicam, such as exfoliative dermatitis or Stevens-Johnson syndrome. We would want to discontinue the medication at the first sign of either of these developing. It's important to note that while using Meloxicam, fever and inflammation may be masked, so it may be harder to get the proper diagnosis. Some patients have experienced an active bleed while using Meloxicam. Patients would be at an increased risk of experiencing a bleed if they had blood coagulation disorders. And finally, for precautions, it's important to note that the use of Meloxicam is not recommended in patients who have severe renal impairment. Now, once somebody has cleared the contraindications and they're made aware of the precautions and warnings, and they start to use Meloxicam, they can expect to receive their dose orally. If an individual is using capsules of Meloxicam to treat osteoarthritis, they may start with 5 milligrams taken once daily. If needed, the dose may be increased to 10 milligrams once daily, and that would be the maximum dose, 10 milligrams. However, if they're using the suspension or tablets, they may take 7.5 milligrams once daily, and this dose can be increased to 15 milligrams daily. If somebody is using the suspension or tablets to treat rheumatoid arthritis, the dosing will be the same as we mentioned in osteoarthritis. So 7.5 milligrams once daily, with the option to increase the dose to 15 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Meloxicam. So I'll go over some of those here now. Some patients may experience abdominal discomfort or abdominal pain. These would happen less than 5% of the time. Constipation may happen up to 3% of the time. And up to 8% of patients may experience diarrhea. Up to 10% may experience indigestion. And some patients may experience flatulence. There's also a risk for patients to experience nausea or vomiting. About 4% of patients could experience dizziness. and about 8% may experience a headache. And up to about 8% of patients may experience an upper respiratory tract infection. Some patients may also experience a fever. Now, some more rare but serious side effects would be angina pectoris, or chest pain, body fluid retention, or edema, and finally, hyperkalemia, or high potassium. That's all we're going to talk about today with Meloxicam. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.